President Cyril Ramaphosa is to address the nation this evening on developments in relation to the country's response to the coronavirus pandemic. On Wednesday last week, Health Minister Dr. Zweli Mkhize announced that we are now officially in the second wave of COVID-19. Health experts have warned that South Africans have become complacent about wearing masks, social distancing and washing hands. We can only speculate what the president is going to say after meeting with the Coronavirus Command Council yesterday. Our next guest, however, has been working closely with data linked to the coronavirus in South Africa. Professor Tulio de Oliveira is the director of KRISP at UKZN and an associate professor at Caprisa at the University of Washington. Professor, great to have you. Thanks very much for joining us.
Good morning, and good morning to all your viewers.
So, Prof, we're looking at, obviously, the fact we've been told that we are now officially in our second wave. It's the same as overseas when the summer season occurred. However, it seems this was predicted, or is it a little bit earlier than predicted? Perhaps you can fill us in on predictions here.
Okay, so it was much earlier than we expect. And you probably remember both Professor Salim Abdul-Karim and the health minister mentioning that we are expecting a second wave after the holiday season. Yeah, but one thing that we have seen from following the data very quick, is that the second wave started around like 4 or 5 weeks ago in the Eastern Cape, and since then it has spread across the coast in South Africa, initially to the Garden Route, but also now through the coast to KwaZulu-Natal and starting to enter the country. Some of the statistics that are normally not in the news but allow us to know what's going to happen the next few weeks is what we call the reproductive rate of the virus, what we call R. And at the moment, for example, in KwaZulu-Natal, it's 1.5. What it means that every second week we are increasing 50% the number of infections. So in reality, I would say that we just start in our second wave, and is likely to be much bigger than the first one if we don't act quick.
Yeah, this is, I mean, these are important predictions because we are seeing an exponential rise. We really are. I mean, the numbers, the last time you looked, it was below 1,000. Then it suddenly went above 2, then 3, then 4. Now we are sitting above 7 every day, if not 8 every day. And these are just reported numbers because there's certainly maybe even more that we perhaps are not aware of. Do you think that could be the case? Yes,
that's the case in South Africa specifically, but also across the world. We normally estimate around 3 to 4 times more infections. Yeah. And that's where another important statistic to follow is what we call the positivity rate. How many tests come positive for how many tests done. At the moment, South Africa is sitting 20%, which it means every 5 tests that we do, 1 is positive. And that's extremely high. The World Health Organization ring a bell when this passed 5%. Yeah. So what it means is that probably the size of our epidemic is probably 4 or 5 times higher than what we are seeing in the numbers.
If we look back to when we first started and the numbers were 13, 14,000, when we were in the first wave earlier this year, what was the positivity rate then?
The positivity rate, the highest positivity rate was 25% in the country. So we are not far from the highest positivity rate. To be honest, if you do, one shouldn't analyze like the daily rate, but we hit that 25% around a week ago when we had a problem with testing. Yeah. So we are not far from the as high as the first wave.
Yeah, we certainly aren't. And I mean, that I think is just to give us an idea of where we're at now in December as opposed to when. I mean, 5% off is very, very worrying. Professor, let's look now and say what can we talk to? Is it the fact that we're seeing South Africans complacent? We've been told by our president, we've been told by numerous health experts what we need to do to try and prevent it, whether it be, wearing a mask, sanitizing, social distance, all of these kind of things. What's happening? What's at the root of why we're seeing this second wave? Are South Africans not listening?
I don't think that just South Africa not listening. This virus is spread very, very fast. The attack rate of the virus is some of the highest that we find in respiratory virus. So if people will mix, even with some precautions such as wearing a mask, sanitizing, you will have a spread of the infections. So I think that we have a two cause problem. One is the population that get what we call COVID fatigue. Everyone's quite tired and want to go back to normal life. Sometimes even more than normal lives, they want to catch the time that they lost, especially with seeing friends and partying. And the other one is the public health response. So what we need it is to have both working very well. What it means is that the public to comply, but also the public health response to be effective, which it means very good and accurate testing, contact tracing, and support people financially for quarantine or isolation. If this two doesn't get in a good balance, the virus will spread very, very fast, which is happening now.
We've looked at a couple of areas, and in the last State of the Nation address, not State of the Nation, the last update from our president, we saw hotspots being identified, and particularly that of the Nelson Mandela Bay and the Eastern Cape, which is of course the Port Elizabeth area. But it's been reported that Buffalo City, that's East London, has now overtaken as the hotspot in the province. What is happening particularly in the Eastern Cape that the virus seems to be such a hotbed there?
Okay, so in the Eastern Cape, what's happened, it is not very different what started to happen in the Western Cape and KwaZulu-Natal. It's what you were mentioning before I come to the show, the way that the virus enters first in the young population, which normally is asymptomatic, so doesn't know that is infected, and start moving across the older population. The biggest problem in the Nelson Mandela Bay and the Eastern Cape is that the quality of the hospitals are not very as good as the rest of the country. And that gives rise to a massive excess deaths. And what the public has to understand is that when the hospitals get completely full with COVID patients, they may not have a space to you if you broke your leg, or if you have a car accident, or if you have a heart attack. So the problem of overwhelming the health system is that's going to have strong consequence for non-COVID patients. So, for example, in the Nelson Mandela Bay and Buffalo City, the excess deaths is already higher than the first wave.
And I mean, you touched on a very important issue in your previous answer, and you're talking about debt now. We're also talking about the fact that, the payment facilities available to South Africans was just not adequate, and people are now petrified of being locked down again because, there were a lot of promises made during that lockdown when it came to people getting stipends, people getting money, people qualifying for all of these things, and they didn't. People were starving, and many interpreted and said that the fallout from the after effects of COVID, not the disease itself, was going to be the biggest killer here in South Africa. And we're seeing that happening. Now we're in a second wave, and for people to actually again listen to government, it's going to be very difficult.
Yes, it will be difficult, but we also have a good opportunity here. And I would describe not as a lockdown, but what we call a circuit breaker. Which it means, because from next week, a lot of the already congregations such as schools, universities, factories, and some business will close down, for the holiday period. So we could use this opportunity to maybe have a quieter holiday, to spend more time with your family, not to compensate with parties and traveling, because maybe South Africa has a good opportunity here, because we are already going to have half of the population out of work or studying, yeah, and it's just about leveling up, yeah, the process to try to decrease the social gatherings, yeah, and with that we may be able to protect a little bit our health system. The important thing about our health system, why it is quite fragile, because we had 20 years of HIV and TB epidemic. And I must tell you, I go a lot to the hospitals. We do a lot of hospital outbreaks. And the healthcare workers, they are at breaking point. Yeah. And so we have to protect our health system. Yeah. And I hope the president today mentioned the idea of circuit breaker. Yeah. To try to decrease, together with the holiday season, the number of social gatherings.
Professor, what are you implying? Let's get an idea from you what you think the best way is for that circuit breaker to happen. There's a lot of speculation, and obviously what you're about to say is speculation too. But what do you think needs to be said this evening to break that spread that we're seeing right now?
I really think that what should be said this evening, and again, that's my personal opinion, yeah, is to bring back the trust between the government and the population, to show that both of them are trying to do the best. What it means, the population to comply and try to change a little bit the behavior, especially in the holiday season, and the government to show that they are investing and they are taking very serious this pandemic, both on the health front, but also on the economic. Because if you have trust between population and government and public health response, that's the way that we're going to try to have a not tragic festive season.
So would you recommend some form of a harder lockdown? Something reminiscent to what we saw before? Or do you think there should be a lot more restrictions? Or do you think we should aim and target the provinces that are worrisome, like Gauteng, Western Cape, KwaZulu-Natal? Those are the kind of provinces that are really looking to be hotspots. Obviously, we've spoken about the Eastern Cape, but what do you think should be said in terms of restrictions?
Okay, in relationship to restriction, as I just mentioned, we are already going to have a lot of the population in South Africa not at work or study. So we already have indirect some restriction on social gathering. Yeah, in relationship to the other provinces, that's the time to act now. Yeah, to try to protect the other provinces to not also grow exponentially. Because it's much easier to focus resource when you have other provinces that are not a big problem. Of course, that South Africa has a fantastic infrastructure, especially from roads and airports, a lot building in the 2010 World Cup. So the virus can spread very quick. Mobility is very fast in South Africa. So I think that we have to be also aware to protect the provinces that now do not have the surge.
Yeah, and a lot of people, I can see on social media, we asked people what their expectations are ahead of the address this evening, and a lot are saying that they think that the president should close down provincial travel. Now, of course, as you've been saying the whole time, I mean, this is the festive season. People go home, people go on holiday. I mean, we see something like the N3 down from Gauteng down to KZN. It becomes jam-packed with cars. Interprovincial travel, do you think that's something that should be stopped?
I think that should be reduced, yeah. And my big suggestion to the population is to take this time to be quiet with your family. Maybe a fantastic time of the year to connect with your children, to connect with your siblings, yeah, and keep a small bubble, what we call like a bubble of relationship, and maybe a great time instead of just traveling far and spend the time socializing and big parties, yeah, to really try to maybe we have a quiet and reflective festive season. This is very important because the vaccine is coming in a few months. So we can see a light in the end of the tunnel. We just have to try to quiet down for the next few months until we have better tools to fight this pandemic.
Prof, you've destroyed a lot of dreams. there are plans, there are holiday plans, and people are thinking, no, Professor, you can't do that to us. The jokes aside, though, I need to end the interview, but just the vaccine you're talking about, where do we stand with the vaccine? I mean, we're seeing rollouts in the UK, in America now, I mean, Russia. There have been a few places. Where are we, though, as South Africa?
So South Africa participate what we call the COVAX. That's the WHO, the World Health Organization vaccine program. So we expect to start receiving that in the first quarter of next year. Yeah, and initially the vaccines will go to priority populations such as older people or with comorbidity and from healthcare workers. Yeah, to at a large scale population, we should have that by middle end of next year, but that will be based also on negotiations with companies, the WHO, and also like on availability of vaccines to the whole world, because we are competing with the whole world for the vaccine.
All right, that explains it to us. So we're with this at least for the next year, and we need to be vigilant as we go about our daily lives. Professor, thanks for talking to us. Professor Tulio de Oliveira, who works closely with the data linked to the coronavirus pandemic in South Africa. The second wave is here. The president is addressing us tonight. What do you think is going to happen? That's what we've asked you on Morning Live. Let's take a break. News.